My question is, how will you improve the accountability and communication within Queensland Health? Specifically, what steps will you take to ensure government policies are implemented effectively by Queensland Health executives and managers?
Accountability and what was the second?
The question is, I'll just reread that, Leslie, because you were a bit quick there. How will you improve the accountability and communication within Queensland Health? Specifically, what steps would you take to ensure that government policies are implemented effectively by Queensland Health executives and managers? And Aidan, would you mind taking the floor for this one first,
Yeah,
please?
no worries. Sorry, what was the first name?
Leslie.
Thanks, Leslie. That's a really good question, because I mean it's a bit of a cliche, you know, and accountability in government, when you put the two words, is almost a bit of an oxymoron. I think when you look at the, and Bob probably wouldn't be too proud of me saying this, but we share a same platform with the Greens when it comes to an upper house in the Queensland Parliament. And whilst it may seem unrelated, the reality is we're the only state in Queensland where we have one, where they have the lower house. It was obviously abandoned in 1922. So as a result, any legislation that's properly implemented is always being compromised now. Without that second checkpoint or that board of review, it's a winner-takes-all approach. So it won't be just the health department where you're going to have a lack of accountability. I think it's government-wide. Every department will. We're in the uncanny position where, you know, regardless of which parliament's in, we've only had 4 changes, the least amount of changes in any other state. We had the Labor Party for 57 years, then we had a National Party here for 29 years, and we've almost clocked up at 20 years. The reason for that very slow-moving pendulum is because winner takes all, so they've got access to resources and they can do what they want without any real checkpoint. And when you've got a government that appoints the governor, the Director Generals, all departments right across, the CMC, the so-called independent bodies, and all these commissions that pop out of the woods, when the Commission does something right, the government takes credit. When the Commission fails, they blame the Commission. I mean, this is the modus operandi of Queensland politics. It drastically needs an overhaul to get any sort of accountability into the Parliament. Until we get that board of review or checkpoint, we'll continue to get what we've always got, because we're in the uncanny position where the opposition could go to the Bahamas and have pina coladas for 3 years and we wouldn't know the difference. And that's an unfortunate circumstance in the political landscape in Queensland.
Thank you. Aidan. Minister.
Very important question. And the dramatic and radical restructure of Queensland Health that we've already announced, and significant parts of which are already underway, are giving effect to a principle that I believe is fundamental to Queensland, to the delivery of health services in Queensland. And it's what I call the servant model of leadership. The only reason for a network board, or the only reason for a head office, is to better serve the frontline staff serving the community in the street, so to speak, or in the hospitals and the health clinics. The philosophical position is service of the centre to the frontier, not the front line, not around the other way, which is a total shift in mindset, I believe, in the way in which Queensland Health as a corporate organisation has functioned. That's why we are instituting the biggest shake-up of Queensland Health, and I'm delighted to be part of it, in a generation. Not just the creation of the networks and the governing councils and the role for clinical staff like nurses in that governing council, but also breaking up the back of office functions of Queensland Health into 2 separate, smaller agencies that have got a clearer idea of what their essential role is, where the lines of accountability are a lot clearer, with the opportunity for more effective communication. So the corporate service function is separated from the clinical and the policy function of the organisation, and leaving a small Ministry of Health more in line with the conventional Ministry of Health in a parliamentary system. But add to that, and this is where you've got to work from the bottom up, I think we've got to drive the decentralisation of decision making within the networks and within the hospitals and the community health centres and what have you, so that those who are on the front line, particularly nurses, have a greater say in decisions about how resources are allocated. Once you get a greater say about how resources are allocated, you'll have people paying attention like they have never done so before.
Thank you.
The driving force in relation to the development, or at least the delivery of policy, will be the networks. There's no question about that. The networks will be accountable to the public that they serve. They are required and will be required to interact with the public and to explain to them how they're implementing those policies. The total overview will rest with corporate office in relation to developing those policies, and the outcomes will have to be published on an ongoing basis in relation to bed occupancy rates, ED occupation rates, ramping, and those other matters that make a hospital system work effectively. Jeff has raised the issue of corporate office being divided into two. We oppose that. And I have spent the last 3 weeks travelling around this state talking to doctors and nurses in the public health sector. And they, without doubt, say to me they are very concerned about this two-silo approach for the reason that they fear two masters developing and the areas of grey between the two escalating and becoming more as time goes by. I am also concerned about hospitals in the far-flung regions of this state having to communicate with two different and separate entities, but potentially in grey areas where they cross over. If one entity is creating problems, making two entities, theoretically, and in my opinion practically, will double those problems as time goes by. We believe accountability will vest and lie with the networks. The corporate office will have to hold them accountable. The networks will have to publish data and detail and communicate with the public, which they serve on a daily basis. And only by making the networks openly and fully accountable to those they serve are we going to get better outcomes and, in my opinion, better transparency in the health system in the state.
Thank you very much. Adam?
I think probably the single most important thing we could do to try to foster better public policy outcomes within health, but I think this applies across the public service, would be to... The current situation is that all senior public servants and public officials in the Queensland Public Service are appointed by the government of the day to short-term contracts. So and often when government changes hands, a number of them get the axe. So it puts them in a situation where their employment prospects are connected with the political fortunes of the incumbent government, which creates a systemic conflict of interest. In the past, when we had such a thing as a public service board that was responsible for the merit-based hiring and firing of senior public servants, and it wasn't within the power of the government to decide to hire them or to fire them. They could complain to the public service board, but the public service board would then make its own assessment of whether these public officials were acting appropriately or not. And that puts the public service in a situation where they're able to say to the government of the day, drawing on their own professional policy expertise and their experience in their portfolio, and give frank and fearless advice, which is what we all say that we want, which includes saying when a policy direction is doomed to failure or is not a good idea and so on. So I think we need a bit more of that in Queensland Health and across the public service. And I think the appropriate body to do it, and what the Greens have been advocating, is that the Public Service Commission be given those powers again to do merit-based hiring and firing of the upper echelons of the public service. And so they are appointed and fired according to their expertise and their performance, and it's all based on merit.